Two. What's going on, folks? Your boy again, Dr. Thomas, back in the building with the Be More Today show. We are back. We are back. We are back in the building. And folks, the Be More Today show continues to grow in the month of April, celebrating Occupational Therapy Month. Last week, we had a great show featuring the Marine Park office and their dedication to making sure that we get back to our functional capacity was great. And we continue the OT shows for this month with a special guest. Before I talk about that, I got to talk about Be More Today. It's a movement, as you already know. We continue to grow. And I thank you so much for your love and your support. You've been subscribing to our shows for the last couple of years, 4 years in total. And the show has grown, again, 78 countries, over 44,000 downloads. Again, thanks to your love and support, this show continues to move. So if you want to keep following us, BeMoreToday.com for my book on Amazon. Our More merch store continues to be out there. If you're looking for a running coach or a running club, our Spartan Sunday Running Club is here. I'm the coach for that team. So join us as we continue our runs outdoors and getting ready for the marathon seasons. Any question you have about that, email me at info@BeMoreToday.com. For any of those things related, you will not be disappointed. And my love for you continues. I thank you so much. It does not go unnoticed. Our quote for today is simple as always. Man and woman, through the use of his and her hands, as they are energized by mind and will, can influence the state of his or her own health, by Mary Riley. One of the things that I've noticed about being a PT myself is that my hands are very important. And a number of patients continue to talk to me and say, you should get your hands insured. You should get your hands insured. Why haven't you got your hands insured yet? What are you waiting for? What are you waiting for? And, at first I played it off. But in looking at all that I do with my hands, it is a tool that we use. As PTs, as OTs, as clinicians, our hands are very, very important to make sure we can help people get back to their functional status and back to the life that they love. And I have on a show a guest that continues to use her hands in many ways and helps those who also have hand issues to get back to the functional capacity so they too can get back to the life that they love. And her name is Shari Bensadoun. Now, Shari is a licensed occupational therapist and a certified hand therapist. She's a graduate of Toro College School of Health and Sciences with a master's degree in occupational therapy in 2008, where she earned a place in the Phi Theta Epsilon Honor Society. After working as an occupational therapist and dedicating her time to continue learning, she decided to further her career within the field of hand therapy and became a certified hand therapist in 2014. She specializes in postoperative rehabilitation and custom splinting and is certified in the Graston technique, as am I. Well done. She also dedicates her time as a fieldwork supervisor for OT students and has certifications in, again, Graston, and so many other things. Ladies and gentlemen, boys and girls, pets included, please welcome to the stage our second guest, or our second show for Occupational Therapy Month, Shari Bensadoun. Shari, what is going on?
Hey, thanks for having me.
Listen, thanks for being here. We can just be completely honest. You and I are busy. And, being a clinician is busy, but doing these shows outside of that is busy as well. So I thank you for making the time today to make OT Month special. And, I hadn't had any interaction with you until our stint with the marathon. We had a marathon cheer section in front of your office downtown.
Yep.
And it was great. You were very, very vital and helpful for us to share our love for the runners and our love for New York City in front of your area. And we had a whole cheer station with JAG-ONE Physical Therapy, our Spartan Sunday Running Club, and a number of runners, including Tiki Barber, who came by, and so many other people who had a chance to be inspired and be cheered on by us. So I thank you for that, opening your doors to us, allowing us to use your site as a host site for that day. It was pivotal for us to do.
Yeah,
We couldn't have done it without you. So I thank you so much.
of course. Thanks for organizing it. It was really great. I've never actually gone and cheered on in the marathon before, and it was really cool. And it was like really nice to see and like support all of those people that were doing that.
Yeah, it's always great. I think it's the best time of the year when NYC comes alive and just seeing so many people with their stories of
Yeah,
overcoming and trials and whatever else. And of course, seeing people who have the injuries, right? The Achilles runners or those who are blind and running with somebody else. It's just
yeah,
amazing. Wheelchair runners, etc. It's insane.
yeah.
But as we're in Occupational Therapy Month, this is your month. And, my main job as our Director of Community Engagement and Inclusion is to make sure that we highlight all the great things that JAG-ONE PT is doing. And I wanted to ask you a couple of questions. We had the Marine Park office on the show last week and talked about a number of things that they're doing in the South Brooklyn area. Now you're downtown Brooklyn. I just want you to talk a little bit about your office and what it really feels like being an OT for JAG-ONE Physical Therapy in the downtown area. Because again, every area is a little different. And in your particular specialty, you specialize, as you said, in post-operative hand
Mhm.
splinting patients. So what's that like being an OT? And what are some of the things that you see on a regular basis?
I mean, I love it. The area that I'm in is it's actually a really great area. You get a lot of different types of people that live there. I One of the things I love is just meeting lots of different people, hearing their stories, hearing where they come from. And being a therapist and working with patients, you develop relationships with them a lot of times because you're seeing them 2 to 3 times a week for over an hour at a time. So it's nice, and I happen to just really love the area that I'm in. It's actually grown a ton, the downtown Brooklyn area, from when I first started there, almost 8 years ago.
Mhm.
It's like really just it's booming now. You got a lot of people that are within that area. The community is growing, which is really nice. Um, in terms of what I see, we see a lot of different injuries. We see a lot of fractures. We see a lot of nerve injuries. We do get a lot of post op, but we also get a lot of people coming in who are trying to avoid surgery. So they're coming to therapy hoping that they won't have to get any procedures done. We get a lot of sports injuries, a lot of arthritis from older patients, work injuries, sports injuries. So we see kind of a gamut you know, of different diagnoses. Um, and then in terms of splinting, that's one of the things that I love about my job.
Mm.
That's where like the creative juices kind of flow, where I don't know if you've ever seen splints being like fabricated. It's just you start with this like flat piece of essentially like a plastic type of material and form it into so many different types of shapes, and it's cool. It's also fun when like patients come in and they're not expecting that, and where they come in with this huge bulky splint that they like bought from the store, and then they come to me and they're like, "This is horrible," and then I make them something custom, and it like their world just like shifts because they have like so much more use of their hand. It's much more comfortable. They're more comfortable with their injuries,
Mm.
so it's great.
I'm not gonna lie to you, I hate arts and crafts. I hated it as a kid. My wife is all into it. She's like, "Oh, let's make this." I'm like, "I don't make anything. I want to just buy something already put together." So when it comes to splinting, I'm like, "What is happening?" But I truly appreciate the artistry and the craftsmanship and the creativity that comes with that. My first job was not with Jag-ONE. It was with a different company in the city, and it was just me, another therapist, and a hand therapist. And she had her own area, and literally, she had 4 tables and people would come in. She would go from table to table doing her thing. And her name was Carrie Bate. I remember her to this day because that was 2009, 2010. And she was amazing. I mean, I just saw her literally make these things and craft these things
Yeah,
different for everyone else. And she did it
yeah,
so quickly and they were different
yeah,
for every single person. And I was like, that is amazing. That was my first experience looking at splinting and um, uh, just really appreciating the OT perspective and the trade of a hand therapist or a hand specialist. And it's just amazing when I can really see those things and see people get better with those things. And I'm sure you see it every single day,
yeah,
clearly. I've actually watched you when I came to your
yeah.
office. I saw you in motion.
Oh yeah,
And
that's right.
yeah, it's art. It's art. I don't know, we as PTs, we do everything with our hands as well, but the creative piece, I think, is something that we don't really for the most part, we don't really get a chance to experience like that, to actually make something like that. Sometimes you make things for people for their workstations or whatever else, but to make something like that, that's pretty cool. So
Thanks.
yeah, I think it's pretty cool. Um, so I'm curious, Sherry, I know that, we talked a little bit about post-ops and hand splinting, but
Mhm.
I'm curious what the top 2 or 3 hand injuries that you see on a regular basis, because there are a number of people who have issues with their hands. I mean,
Yeah.
you don't really know what's going on with your hand until you have an issue and you recognize
Yes.
how important your hands really are. So,
Right.
what are some of the top two or three hand injuries that you see on a regular basis?
So I will say carpal tunnel is definitely up there. And arthritis is also pretty common, especially in the older population. And fractures, those are the three that I would say. And like, I mean, it's a variety of fractures, wrist fractures, finger fractures. But those are the three top injuries that we see.
Okay. So with those top injuries, and I'm kind of in there, if you can see my pinky, I had a mallet
Oh yeah.
fracture. This is years ago playing basketball, but these things happen, right?
Yep.
So
Oh,
what is,
basketball, that's super common with
yeah,
finger injuries.
yeah,
Yep.
exactly. Exactly. Dislocations and whatever else, right?
Mhm.
So what are some of your tips on how people can avoid these injuries, if any?
Yeah. So, with fractures, there's not too much to do to avoid, except there are certain things that you can do, especially sports that people tend to fall a lot. So snowboarding, let's say, or skiing, um, wearing wrist guards. There's actually
Hmm.
a lot of people don't do it, and you fall and you tend to, that's, you brace yourself with your hand. It's one of our natural instincts, and that's why a lot of wrist fractures happen. But if you're doing a sport where you can put a wrist brace on where it won't impede your function in the sport, I definitely recommend that. um, Also, learning, sounds weird, but learning how to fall properly.
Hmm.
I do some rock climbing, and one of the first things that they teach you, they don't even let you start until you fall properly off the wall. So things where you're going to be falling backwards, or even in any sport, like, I mean, in basketball, football, if you get knocked down and you're falling backwards, one of the main things to always remember, like, tuck your arms in. Don't put your arms out. Our natural instinct is to put it out. Try to train yourself to bring it in.
Right.
Um, so that's what I would say in terms of fractures. You can't always prevent a fracture, unfortunately. I fractured my ankle and tried to fall as best I could when I was rock climbing. Didn't work. um, so not everything's preventable, but there are certain things you could do for that.
Right, right.
In terms of arthritis, so there are different types of arthritis. The most common one is osteoarthritis, which happens with, it's just a lot of times with age, but it also can happen from like improper use of joints. So when you're putting a lot of pressure on a joint repetitively, you're going to wear down that cartilage a lot faster. And that's essentially what arthritis is. It's the bone rubbing on bone. That's what's causing the pain. So doing different activities, I would recommend using bigger muscles, using bigger joints to help pick things up, help lift things, help move things. Number one, you'll save your back also, but
Mhm.
just trying to not protect your hands. Don't put as much pressure on your hands if you don't have to. So, if you're carrying a really heavy bag, don't carry it in your hand. Stick it on your shoulder. That's going to be a lot easier. And obviously, again, you can't always prevent these things, but trying to minimize a lot of pressure that's on those smaller joints. Also, if you do have an injury, go get it checked out. A lot of people think that, oh, I just sprained it and it's fine, and they let it go for months. And if you did end up fracturing something and you didn't know, the bone's not put back in place properly, then you're going to put yourself at risk for early arthritis. So don't be scared of going to doctors, even going to therapists. If you don't want to go to a doctor, go get seen by a therapist and try to get injuries checked out to prevent further injuries down the road. Um, in regards to carpal tunnel, everyone always thinks they have carpal tunnel whenever their hand hurts.
Right.
um, but typically, if you're getting like numbness, tingling, that's usually what it is. And especially now with people working at home or, office jobs where you're sitting at a desk all the time, you really want to make sure you have a good setup. So making sure your feet are planted on the floor, your knees are at 90 degrees, hips 90 degrees, elbows at 90 degrees, and you want to keep those wrists straight. So a lot of people don't realize when they're at a computer, their wrists are, can't really see me well, but they're kind of bent back like this, and they don't realize that they're in that position for hours at a time. When you do that, you're just stretching the nerve. So I recommend to a lot of people getting those like keyboard pads
Hmm.
and using that to rest their hands on, because that's essentially keeping your wrist straight. Taking breaks, not a long break, but if you're sitting at a computer for hours, and some people always tell me like, oh, I forget to take a break. I don't know how to remind myself because I just keep working. Tell people set a timer every hour or two, just have a timer go off, and doesn't have to be a long break. Take a minute, shake out those
Hmm.
hands, do some stretches, and then continue. Keeping those so you're not keeping those wrists in one position all the time and compressing that nerve.
Right, right. Yeah, I just had that conversation with somebody literally yesterday. Because she was like, "Oh, why does my hand hurt so much?" I said, "What do you do?" She said the same exact thing. I'm typing at my desk all the time. I said,
Yeah.
"Oh, well, that makes sense. That makes
Yep.
sense." And the first thing you said was, "Oh, is it carpal tunnel?" And I said, "No, no, probably not." And for her, it was more like an epicondylitis issue because she
Yeah.
wasn't really working on the proper work setup for her. But same thing, those overuse injuries, right? The wrist
Yep.
flexors, extensors, all those things when they don't get a chance to rest, then they're on, like you're saying. And
Yep.
yeah, I think a lot of us, like you said, coming out of COVID, not us per se, because we were working, but others who were home on Zoom definitely were experiencing a lot of those things. And the internet does not
Yeah.
help, right? People just go on automatically and look whatever they see, and carpal tunnel is the first thing that usually pops up. They think they
Yep.
have that, and they look for things to do for that, which is not going to help if you don't change your
Right.
workstation. So
Exactly.
yeah, I'm sure that's challenging for you to continue to explain it to every single person you see, but that's kind of
Yeah,
part of the
but
job.
you know what? It's honestly it's par for the course, and it's also like I'd rather people come and ask rather than just assume. And
Mm,
then like a lot of times I will get people coming in asking like, "Hey, I think I have carpal tunnel," and then once we assess them, we're like, "Actually, no, you have a certain type of tendonitis," and then we're
right.
able to like steer them in the right direction, but still with proper ergonomics is always key.
Yeah.
Especially like we said, working from home, sometimes a home setup is not even as great as what you were used to in your office. So just trying to make sure you have a comfortable setup for yourself, and you're just in a good position and taking breaks.
Yeah.
That's key.
So I want you to speak. I know there are a number of students who were in Zoom classes during this pandemic. A number of them I know, were home doing classes in their beds, right? Computer on their
Oh
lap in their
yeah.
beds or laying. Can you just talk about like how detrimental that setup can be for like neck, shoulder, and
It
wrist
is
issues?
terrible. I mean, you're in that hunched over position for so long. And that's typically, I have so many friends that were doing that. So a lot of my friends, I even went like back to school and were taking classes, and they were taking classes from home, and it was the exact same thing, or sitting on the couch, like lying down, looking up at the computer. um, it puts so much strain on your neck and on your shoulders. I even experience it, working on patients. You're a lot of times you're hunched over them. You're gonna just you're going to end up with so many other issues. I mean, I have people who ended up with like chronic headaches just because
Mm,
their muscles were so tight in their neck. And then once they started doing proper stretches and they started being in better positions, the headaches went away.
yeah.
So yeah, it's even though you feel comfortable at the time and you want to be lazy, but you'll you'll put yourself in a much better position if you put yourself in a much better position.
That makes complete sense though. Yeah. And I think a lot of people just we get lazy, we get tired.
Yeah,
You and I, not for nothing, we just came home from work, we're tired, but
yeah,
making sure that your workstation is just ideal for whatever you're doing can help alleviate so many other issues, including problems you may have the next day. Might not feel
yeah,
bad in the interim, but at the next day you can feel a little something. So
exactly.
yeah, that's great advice. And my next question for you is looking at you talk about arthritis. And I know a number of people, culturally and otherwise, have mentioned to me this same question about cracking knuckles, right? I'm sure you hear this all the time. If I crack my knuckles, will that lead to arthritis? And even when I was growing up, people were telling me, don't crack your knuckles, you're gonna get arthritis. And I didn't do it because they told me it was a bad thing. But I wanted you, if you don't mind, just to set the record straight for all the listeners who are listening from various places, no matter
Yep.
where they came from. Can you please talk to us about this myth slash
Yes.
truth and just give us some
Yes,
insight
it
on
is a
that?
myth. Crack your knuckles all you want. It will not lead to arthritis. I crack my knuckles all the time. um, to try to give you like an idea of it, all you're doing is you're releasing an air pocket that forms within the joint. So a lot of times people are like, no, but I've heard that it still does. So I'll have them crack their knuckle and then ask them to crack it again right away, and they can't.
Right.
So the reason is because that air pocket has to reform. All you're doing is you're just releasing the air. So that's why you can't crack the same knuckle right away. You got to give it I actually don't even know how much time it takes, but it's a bit of time in order to be able to crack it again. You will not do any damage, I promise. Enjoy cracking.
I just think it's funny because people ask the same questions to me. I mean,
Yeah,
we don't have a number of hand injuries that we see, but the ones that we do get are usually conversational. Like, hey, what do you think about, and I'm like,
yeah.
what are we talking about? But it always comes up in conversation. I'm like, who started this? Where did this come from?
I
But
also wonder where it came from.
yeah, but it is a funny thing because I do see that there are things like that, even like the carpal tunnel thing, sciatica is another thing. When people get it, oh, I have sciatica. It could be a
Right.
number of things besides sciatica, but okay, that's the one we're going to talk about, no problem. But those things happen in our profession where yet people get locked in on a diagnosis or that they think they have a certain thing and they just want to do everything for it. And that's why it's so important, I think, for people to see OTs and PTs because then you get a chance to really see, is it really what you think it is? Because
Yeah.
usually it's not. And
Right.
WebMDs and those kind of things, Google, Siri, whatever else, can lead you down a rabbit hole of madness. So when they come to see you or me in the clinic, they already have anxiety because they've been online already. I've had people coming to me for an eval with Google printouts,
Yep.
being like, "I think I have this." And I'm like, "Hold on a second. Let's just see what's going on." I'm sure you had the same thing.
Yep.
Yeah. So it's always good to see the specialist and see what's going on and ask the right questions to make sure you get
Exactly.
the right answers. Sherry, I'm curious. So, occupational therapy, like PT, I don't know about Toro, but at
Hmm.
Downstate where we went, we had a number of classes together. I talked about this a little bit on the last show last week with the Marine Park office. Um, but even looking at the classes between PTs and OTs, I always noticed, at least at Downstate, that there were so many more female students than male students. And even looking at our JAG-ONE company, I'm looking at around, all the OTs, there are much more, predominantly more female occupational therapists than males. And I'm
Yeah.
just curious if you had any insight on why that may be.
So I did also have that in my school as well. I would say like at least 75% of my class was female. Um, I've thought about it. I think I don't really know the answer for why, but I have things that I've thought about is maybe where the profession started. Because the profession started, I mean, we're talking decades ago. It started after, I forget which war it was, but it started in the mental health profession. And they use a lot of, so it was mainly focused on mental health for people coming back from war. And they were using a lot of art therapy. And it wasn't as physically based. So I think that at that time when it first started, that could be why you were getting a lot more females in the profession.
Hmm.
And it's definitely, obviously, over the years now shifted, and it's a completely different profession from how it first started. There's still the mental health aspect. There is still mental health OT that exists. Um, and when I was in school, we did field works in it. I'm not sure if they still do it. It might be like an elective field work. Um, but that would be my guess of more just how the profession started. And you are seeing a lot more male therapists, like as the years go. A lot of my students, it used to be that 6 years, like 6 years ago, 7 years ago, 8 years ago. I mean, even when I first like started taking students, like 15 years ago, it was all female students. I had one male in like 7 years of treating. I had one male student and everyone else was female, and I see multiple students a year. um, Over the past, I want to say, 4 years, I've been getting a lot of male students. So I think it is definitely starting to pick up more. um, I'm not exactly sure what the shift is. It could be that they're seeing the more medical aspect of the profession, and the profession is not solely focusing on the arts and crafts aspects and the mental health. So you're getting a variety of different people who want to join the profession.
Hmm.
But that would be my guess.
Yeah. Yeah. I'm just curious,
Yeah.
I just saw different things and different trends. And, at least for us, I was surrounded by a number of female students when I was in the PT program at Downstate. And even working in the hospital, it was more of a balance between men and women. And even, at JAG-ONE, we have a number of clinicians who are pretty much even on both sides for the most
Right.
part, probably a little more men than females across the board, but that also varies in terms of states.
Hmm.
So, I was just curious if you saw the same trends that you did. And
Yeah.
I agree with you. I think that that's maybe one of the reasons why there may be a weird shift. Um,
Right.
but I do think the one thing that I agree with you on is the mental health component being so integral. And I'm reminded every time I look at even in looking at last week's show, talking about the mental health component and how important it is and integral it
Yeah.
is to the OT experience. We as PT, we deal with that a little bit. And I
Hmm.
think depending on the therapist, you may deal with it a little more or less depending on your style of treatment. But I do know for occupational therapy, it's such an integral part of the
Yeah.
healing process. And I just want to get your thoughts on the quote. We talked about using hands, and they're energized by mind and will to influence the state of one's health. Um, how did you infuse, I guess, in your
Hmm.
expertise and your experience and your vast knowledge, how do you infuse your clinical manual skills along with the mental process of healing for your patients? Because I know, just anything hand related can be very, very intimate.
Yeah.
And, us as therapists do a number of things that are intimate as well, but there's something very intimate about hand.
Yeah.
Just like that intimacy that comes with someone who is treating you and healing you in a certain way. So I know that a lot of mental health or psychosocial things can come in conversation when that intimacy is
Absolutely. Yeah.
exposed. So, what are your thoughts on, I guess, some of the ways that you've seen um the benefits of looking at the mental health aspect of it and the physical health aspect of getting people back to the life that they
Yeah.
love?
So I find that it's twofold. There's the aspect of the relationship with the therapist and with the clinician.
Mm,
Um, in order for a person to heal, they need to feel comfortable and they need to feel safe in the hands that are treating them. So I find making sure that first, when they first come in, that people are comfortable. I also find answering their questions. A lot of times they come in from seeing a doctor who didn't really explain what it is that they have and really like kind of laying it out for them and giving them like in layman's terms. Because a lot of times medical professionals don't use layman terms. So they like, you can use all these big words of muscles and different names for different things and how they're going to treat. But like, if the patient doesn't understand what's going on, if
hmm
they don't know what their injury is, they're not going to really understand how we're going to treat it.
Right.
So I'll even sometimes like draw like people will come in with trigger finger, and oh, that's another common injury that I see. um, but I will a lot of times draw a picture for them of their hand and their finger and like the tendon and what's actually going on in their hand, and then they have an understanding. They're like, oh, that makes a lot of sense, now I know why I'm having this pain.
Yeah.
And then explaining to them the whole process of what we're going to be doing and how it's a team approach. It's important that you're comfortable with me, it's important that you do what you need to do at home, and it's important that you also come to therapy. And I always tell them, like, you can come to me twice a week, but if you do nothing on your own, you're not going to get there. So it's a matter of them seeing like the whole process of like I said, teamwork. Like I never want them to think that I'm doing it and they have no say, or that they're just going to pick everything and I'm not going to help them along in their journey.
Yeah.
It's unfortunate. A lot of times I have patients that will come to me that say like, I was going to and not to badmouth any other place, I don't even know the names of some of these places, but they'll come to me and they'll say, oh, I'm surprised at how much I'm doing here. Like I've been to other places where they just put heat on me and I do a few exercises and I'm out in 20 minutes. And I'm just like, that's so upsetting. And to hear that like they don't even get any manual therapy or they don't even do any exercises, like getting them to see the whole approach of how each aspect is important. And also, I work with my patients. There are a lot of times that they'll say that they're not comfortable with one exercise. So, what? Great. We tried it, it didn't work. Let's try something else that works for you that might not work for somebody else. So I think getting patients to just be comfortable and feel like they have a say in their treatment and that they feel comfortable with the person treating them is really important. Um, and then I also think the other aspect is them believing that they can get better. I
Mm,
just had a conversation tonight with a patient. where I was telling him we were working on bending his thumb, and I was giving him a target to hit, and he just kept saying, no, 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 I can't. So I was like, I don't want to hear I can't anymore. I'm like, I want to hear I can. And even if you don't make it, you're trying. And that's all that matters. And so I would ask him, are you ready? And like all the time he kept saying, no, I can't. And he was also saying, no, I'm not ready. I'm like, okay, you let me know when you're going to be ready. He's like, no, I'm never going to be ready. I'm like, yes, you will. I'm like, we're going to change that mindset. All I want to hear now is I'm ready and I can. And you know what? He hit the target with bending his thumb. And I really believe it might sound like very cliche, but honestly, changing your mindset a lot of the time really can help you achieve so many more goals than you thought were possible. Um, so I tell my patients, I can't is not allowed in my clinic. You want to say it's really hard, this sucks, I'm in pain, go for it.
Right.
I also tell my patients, like, curse me out, I don't care.
Yeah.
Like, but you cannot tell me you can't.
Yeah. Yeah.
So, and
You're right.
it makes a really big difference.
You're
So
right.
I think, getting them to believe that they can achieve things and also building that trust with them, that really helps with their healing process.
You're right. I agree with you 100%. And, I think one of the things that I took from that just now is they have to believe.
Mhm.
You gotta believe it. I think us as clinicians, we believe that we can get anyone back to whatever because we've seen it. We've seen a number of
Yeah.
people go through the journey, right? From
Yeah.
start to finish. Like you said, from post-op, even from pre-op, right? To post-op to being back to doing whatever they want to do. So we've seen it. We know it. We believe in the human spirit. We believe in science, all those things. So we can see those things happening. But I think it is hard for people when, like you said, they are depressed, they're anxious, they
Yeah.
don't trust.
Yeah.
They're going through something else that is also just kind of in the back of their minds, and then the pain levels that
Yeah.
we don't experience all the time. But we've been through things in our own lives, but in the moment, pain is that's the present. So all those things make it very hard for someone to say I can.
Yeah.
And I'm the same way. And I think as clinicians, it's our duty, and this is my issue with some new clinicians that I've seen, not at JAG per se, but just in life, just in general. I think there's a perception that this is just a job.
Right.
And it is a job. But at the same time, it's definitely a mindset. It's definitely like you have to be a clinician who has a positive nature to help
Yes.
other people get through their issues.
Yeah.
Because no matter what you're going through in your regular day, whatever else, the people that we're seeing, they have real problems. They're going through pain, they're going through
Yeah.
surgeries, they're going through problems. And for us not to have faith that they can get through this or not to be able to push them through that thing doesn't help. The mental capacity that you're talking about is a real thing. And I think that the good clinicians, the great clinicians, as I mentioned last week, are the ones who put those two things together. They say, you know what, let me inspire you, let me push you, and let me
Yeah.
also give you some words of encouragement. Let me feed into you a little more confidence than you may be feeling today to let you know that you can do this. And it might not happen today. It might not even happen next week,
Right.
but I know it's going to happen.
Yeah.
And I think that's why, Shari, you're a great therapist because you instill that with your patients every single day. And I can just tell by talking to you on this podcast that it's not something that you're just doing as a job. You actually truly believe in the versatility and the strength of us as humans to get better by pushing ourselves to the limit. So I
Yeah.
salute you.
Thank you.
I salute you. I
I
do. I
appreciate that.
do. And last question, I just want to know if there any thoughts you want to share, any advice you have for new clinicians, aspiring OTs during OT month, or any advice, as a seasoned clinician as you are, just about, ways that you can continue to, like we just talked about, push people to be their best, or anyone who's going through
Yeah.
a hand issue and maybe they're feeling a little down and not believing that they can get through this thing, from an OT perspective, what are some thoughts you want to share with anyone in those categories?
Well, new clinicians and aspiring OTs, keep pushing through. School's rough. We've all been there. Um, but don't give up. It's always going to be a little bit challenging, but it's believing that you can do it. Putting the time in, and you will get to where you want to be. And ask. You'll have field works with clinicians. Ask them questions. I love when my students ask me questions. whether it's about certain diagnosis or even just like studying for the exam, even though the exam was many years ago, but I still try to give them some tips of what I used. um, and, just asking, even in terms of like the different areas of the professions, like you're going to be volunteering different places, you'll be doing your field work different places. Not every area of the profession is for everybody. The beauty of OT is that there's so many different areas to work in. There's pediatrics, geriatrics, hand therapy, there's hospital settings, there's mental health. There's like really something for everyone. That's one thing that I really love about this profession, is that you can work in so many different types of places where, if physical disabilities isn't for you, you can work with peds, you can work in a hospital setting. And like I said, like it's just, you have just so many different areas to look for. And also always listen to your patients. I have like run into different clinicians where, after you've like been in the profession for so long, you just feel like, no, I know what's going to work and this will work and that's it. But having that rapport with your patient and listening to your patients and hearing where, the different struggles that they're having, and realizing that certain exercises that do work for a diagnosis might not work for the patient. You don't want to just look at the diagnosis, you want to look at the patient as a whole. And for patients, don't give up. Just keep trying, keep going, talk to your therapist, and, make sure you're comfortable where you're being treated, make sure you feel like you're being heard. And you'll achieve what you need to.
Awesome. Shari, you have made this show one for the books. I appreciate you so much. And again, thank you so much for just being on the show and for highlighting another series for Occupational Therapy Month. You are now adding to the second part of this series for us. We have one more series to go, one more show to go at the end of this month, highlighting one more OT for our OT month. But thank you so much for making this show one for the books. I really, really appreciate
Yeah,
it.
thanks so much for having me, and thanks for, bringing light to OT.
Anytime, anytime. And folks, don't forget what she said. She says so many things just about resilience, right? And making sure that you believe that you can get through those things. Whether you're an OT who's out there treating others, pushing them every day to get more and to be more, or if you're on the patient side and you're going through an issue where you feel like your thumb is not going to be able to move as much as you want it to, or your body's not going to be able to do what it knows it can do. Maybe not today, but at some point in time, that can get done. And our quote talks about that, right? Man and woman,
Yep.
through the use of his or her hands, as they are energized by mind and will, can influence the state of his or her own health. You can do it. You can do it, but you've got to believe and you have to be energized in your mind and your will that you can get that done. Folks, thank you so much for joining us today. As always, if you want to know about JAG-ONE, jag1pt.com for all your PT, OT, AT needs. Check us out. We are, again, New York, New Jersey, Pennsylvania. We are big and we're doing great things. If you want to continue following the Be More Today show, we are everywhere, Facebook and Instagram, Be More Today _ show at Instagram, Be More Today _ PT. And of course, me, I Dr. Sean Thomas on Instagram. Subscribe to the show, folks. Subscribe on YouTube and on your favorite podcast platform, Spotify. We are out there. Apple Podcasts, we are out there. And if you already know about us, please BeMoreToday.com for all other things. As I always say, have a good day, have a good night, have a great life, and continue to take your steps to greatness to be the best version of you. I'll see you next week. Peace.